Do you want a resource that's going to help your practice or your network look at the strengths, weaknesses, opportunities and threats of the coming years? Well, we're going to cover that right now in this episode. Let's tech enhance your primary care and learning. If this is the first time we're meeting, I'm Dr. Gandalf of EGP Learning, and in this video I'm going to show you a useful resource that will help your practice or your network tackle various different aspects and planning over the coming years. I like to call this tool DR PESTLES. It's an extrapolation of the PESTLE analysis, and with it, if you sign up, you'll also get the additional document that shows you how to use this tool effectively for your local area. If you've got any questions, feel free to contact me at drgandalf52, and don't forget to subscribe to the channel. Let's get straight to the video. Shall we begin? Hi GP learners. So today I'm going to show you a tool that I've created that hopefully will help your network develop a continuity in terms of how they can work with combination of the practices that are working within that network. And I call this tool DR PESTLES. So effectively, some of you may have heard of a PESTLE analysis, and effectively this is an extrapolation of that designed around primary care. There is two parts to this resource. First is the spreadsheet itself that details all the various different areas to consider. It may not be an exhaustive list, and obviously welcome to have a look and see if there's anything else you can add to this, but hopefully you'll find it's a comprehensive list of areas to consider in terms of a SWOT analysis for your local practice that then can be shared within your network, or particularly to the clinical director of your network, to give them an idea of the combined areas of strengths, weaknesses, opportunities and threats for each practice that constitute that particular network. And the idea being that by sharing your particular resources and information, that you can then design services around what you need to deliver for your area a lot more effectively, because you know the individual challenges and areas that need to be addressed. The second part of this tool is effectively a document that explains how to use a spreadsheet more effectively with some added resources that may help to enhance the work that you're doing looking at these particular areas. Shall we have a look? So first of all, we've got the actual spreadsheet itself. So this, as you can see, is a simple instruction part of it to show you how to use it, effectively telling you that this can be used as part of your practice or PCN to design an idea of what you want to do in the next coming years. I suggest that you fill in each section that's applicable to your practice or PCN, depending on how you want to use this. And that does mean that there will be some empty boxes. Do not worry about that. This tries to be an all-encompassing thing, which will mean that certain practices will not be applicable. I have suggested using a RAG rating for each particular area. And the reason for that is often we are not great at prioritizing what we need to do. And one way to try and tackle that is to identify, particularly visually, the areas that you need to focus on. What I would suggest in terms of trying to prioritize that is that you have no more than 2 red categories per page, because otherwise you're going to get very bogged down in terms of what you need to do. And in terms of amber and green, make sure you discuss within your practice where exactly things sit. A suggestion in terms of red being something that needs to be dealt with in the next month, amber being something that needs to be dealt with in the next 3 months, and green something that needs to be dealt with in the next year or so. Hopefully that's a useful guide in terms of what you could potentially use this tool for. But obviously you can change those criteria to suit your needs, or of your practice or your PCM. And then, like I said, potentially sharing this within your network itself to give a better idea of what you need to do. If you're interested in more resources like this, obviously you can contact myself, or sign up to the EGP mailing group where there's a variety of resources like this. And obviously if you want to see more videos and that kind of stuff along this content, then sign up to either the podcast or the Tip Thursday, where you can watch this kind of content and things. And I've also put the link into the video. You'll see that in the final version. So in terms of the tool itself, the first part to have a look at is the demographics area. So this is the D of DR PESTLES, and it's basically looking at various different aspects within and around your practice. So for example, the local population, the breakdown that you have in terms of that, and the particular characteristics that will form the complexity of the types of patients that your particular practice is having to look at. As I said, you can put as much or as little information on here as possible, and there are various places you can get these kind of information from. Good place to start would obviously be your local CCG. They will probably have most of this information already for you. However, working with other groups like the local authority, that kind of stuff can give you added value. And then looking exactly at what you need to do in terms of your practice area. In particular, looking at the communities around yourself. So are you a practice with lots of retirement or nursing homes around you, or in terms of higher need, those extended care homes, that kind of stuff, or other populations that cause challenges in their own individual ways. I've also put down a section for you to have a look at the practice staff. Now, you could use this section if this was the only part you wanted to do. However, there is a later section that goes into this in more detail, so choice of where you would prefer to do this. This is just simply if you wanted to list the number of staff and that kind of thing that you've got, and particularly challenges or opportunities that you've got within the staff mix-up that you currently have. The next part is regulatory, so the R in Dr. PESTLES. And as you can see, I've got all the various acronym-based organisations that monitor, observe, and in some ways support us as well. And I've also planned for some of the features. I've also included things like the ICS and the ICPs. That may obviously change over time, so at this stage, for some areas that may be set out, for other areas that may not be. And in terms of the implications that they have, I've put multiple PCNs on there because I'm aware that some practices will be part of multiple PCNs. And obviously things like your local LMCs and local federations if you're in one or two or whatever. Also put down GP training because I think that's applicable to many practices in terms of how they work and the regulatory frameworks that they have to abide by in order to maintain GP training, as well as other clinicians and medical students. And then lastly, other kind of things like indemnity, mandatory training, that kind of stuff that need to be done in order to maintain the practice itself. So, where are the challenges of this? Where are the opportunities? What kind of things can you look at? For some of those, they are in the extra document that, as I said, is available. Next up, for PESTLES, we've got political. And this is obviously going to be a key area that I think many practices don't consider, but need to consider. So we've obviously got national things. Clearly, at the moment, we still have Brexit being the big looming thing over almost everybody's head at the moment. But there are national other political challenges. For example, access. And there is obviously things like the contract itself that many of you would have read that came out a week ago, as well as local priorities. And this particularly will feed into things like the ICS, the ICPs, and the local CCG and other kind of priorities that are developing, as well as those of the local authorities. Do not forget that the PCNs are designed to offer community care, and therefore working with your neighbours is going to be important. However, there are other areas to consider. So what is your relationship like with the local press, which actually has a huge impact potentially on how practices and particularly networks can function? Is there other opportunities that are available in terms of subsidies, funding, and what changes are coming in terms of infrastructure in your local area? If you are an area that's growing, for example, is that going to be a significant implication on the services that you can deliver either as a practice or as a network moving forward? Identifying these, recognizing them, key challenges and importance that's there. Economical. This is probably the area most people focus on, and rightly so. It's a huge part of the work that we need to be aware of, but also it's important to make sure that you are balancing it in terms of other areas. So clearly, current financial challenges, practice budget and income. As I said, share as much information as you feel comfortable sharing. I'm not suggesting by any means that people go into baseline budgets and all that kind of stuff, but are there particular challenges that you see with your income coming up? Are there particular opportunities that you see? Again, fill in as much as you want. Simple things like county charges, banking, all that kind of stuff, information that's very valuable and things. And then, as I mentioned earlier, the workforce comes up later on, and in particular, clearly an economical thing in terms of stabilization of your workforce and the various different types, particularly looking at the multidisciplinary team, your existing, as well as potentially planned workforce areas that you may want to consider. I think this area, particularly for practices to have a look at, would be very useful. This sort of information you may not want to share with your network. You may want to. It's up to you. As I said, use this document as you feel best. There's nothing to say you can't use one version for yourself and another version you share with your network as well. But obviously, clearly useful information there and stuff. And I think, having a look at that would be valuable. One thing I would mention in terms of the economical side of things, some of you may remember a few weeks ago I produced a document called the EGP Drama. This was a business plan to try and be an addition to the business continuity plan for practices. This is available on the GP productivity page on EGP Learning, and may be an interesting adjunct to what you're doing here to make sure that you're stabilizing your practice effectively. If you want to have a look at the video, feel free to do so. It explains that document in more detail. Social. I think it's important that we do look at the social aspects around our practices and stuff. So this is in particular looking at various different areas like the practice ethos and culture that you have within your practice itself. and actually what are the social implications of your particular population. Do you have particular challenges in terms of cultural norms or values in your area? For example, you have a lot of ethnic minorities whose health beliefs will be completely different in ways of the other populations. Do you actually need to recognise that and also develop services or capacity around those health beliefs? Because whilst it may be easier to say, well, we do things our way, sometimes that can hit a block that therefore means it's more challenging and creates more workload. If you look at the Pareto principle that talks about the fact that 80% of our workload comes from 20% of the things that we need to do, actually, if you can tackle some of that 20% to reduce it, the gains are particularly more sizable. In terms of the social side of stuff, though, it's important to work with people in your community, so particularly local community groups and leaders. Religious groups and leaders may be something to talk about, and clearly the educational institutions, so things like the local schools, primary, secondary, universities and academies and that kind of stuff as well. Many of you know I talk a lot about social media and stuff, and definitely the way that you use social media to engage with your practice population, the people around you, is clearly going to be valuable. What systems do you have in place? Do you have any opportunities or areas that you want to consider in this? Particularly, maybe worth looking at the social media course that we're developing for EGP Learning for Practices. Really valuable resource that I hope many of you will find effective, coming out shortly. Working with your PPG in terms of the practice population, a good functioning PPG can be a really valuable thing, and obviously your relationship with the PPG is going to be exceptional. But also, how do you get information? Feedback channels, all that kind of stuff. And lastly, because I think it needs to be put on there, how do you look at your practice morale? How do you look at fun in your practice? So some of you may think, why is that part of the planning? It needs to be. It really does. If it's not part of this, it's going to make things more difficult for you. Moving on, a key part of the long-term plan and the GP contract is looking at digital primary care, and we're going to see this increasingly. So surely we need to look at the technology resources we have in practices. Look at your hardware, your software, the way that you work both locally and nationally. There are differences there. Obviously, the big systems like System 1, EMIS, how they work with other systems is something that is beyond the scope of an individual practice potentially to change. However, locally you may have other systems that cause complexity. You may have other systems that make life easier. How do they work? Where are the opportunities? Where are the strengths? Where are the threats of those kind of things? Digital literacy and patients' access to digital is going to be a huge part of what we do in the work moving forward. So definitely having a look at these kind of areas is going to be exceptionally needful and important to tackle. There is the part of the GP contract that looks at 25% online use of appointments and things. Well, actually, in order to get effective use, you need to make sure your population are using digital effectively. But if they don't know how are you going to achieve that? Working with groups that may support you with that. Again, links to these kind of things are included in the extra document. And then other kind of things, the way that you work. Do you need to consider remote working? With estates being a huge part of the problem that we face, is this something that we need to consider and look at in terms of remote working? And other kind of things like standard stuff, internet supply, telephony, other kind of resources from a technology point of view. This doesn't deal a lot with the clinical technology. I've stayed away from that particular area, but that's clearly something you could add if you felt that was appropriate and things. Legal. So this is slightly different to regulatory. This is looking at the legal implications of the work that we are doing. Particularly big nuggets are obviously GDPR and SARS, current challenges for many practices, but also kind of things like information governance and the coroner's service and police service are things you need to consider in terms of the relationships that you have with them and the impact they may have on your workload. And then finally, things like complaints, compliments, very important, and also contract changes. There is clearly some blur in that last part in terms of the earlier stuff in terms of regulatory and things, but I thought it was useful having separate parts to identify if there are separate areas you need to consider. Environmental issues are a key thing that practices may need to consider, particularly in terms of how you work, in terms of local climate, paper light, all that kind of stuff. And included in this is obviously things like health and safety, but many practices are leading the way in terms of being more environmentally conscious and stuff. And actually this can be something that can have impact in terms of the way that you work moving forward as well. And finally, the extra part of the DR PESTLES kind of thing and the additional part is services. So in particular, looking at this, what I've focused on is the types of services that work around the practice in particular. So definitely things like community care aspects and that kind of thing, district nurses, health visitors, parts of the multidisciplinary team that work with us. What kind of areas do you need to consider when assessing them? In terms of other areas, school nurses, social prescribers that will be coming as part of the networks moving forward, community pharmacies, are they a resource that we need to work better with? Midwifery, social services, all that kind of stuff, as well as extra things. The reason there's multiple lines for secondary care, obviously you may have multiple secondary care providers around you rather than one big hospital, in which case, how is your relationship with them? Is it different based on the different kind of providers? How does that work? And then also, again, federations appears in this particular area just because they are potentially a different aspect, because there's the regulatory aspect of being in a federation, and there's a service delivery part and the provider section of being in a federation. They are different, and just use the category that you feel works best for yourself. Use both if that's applicable. Finally, I've put some extra kind of groups in there. So third-party groups, activity groups, wellness, self-care, all that kind of thing that, again, sits around the kind of area that we work in. Community care services can be considered differently in terms of the actual community care areas and things, but have a think about where these fit and stuff. I hope this has been a useful explanation of the spreadsheet itself, and I do hope you find it useful. One of the key things I said that comes with this is the documentation to give you extra resources to fulfill some of this criteria. If you're interested in having that document, you will need to sign up to the EGP Learning mailing list, because that is an extra resource I've created for those people that are following the list and things. But I do feel it will give you that extra resource to tackle how to look at the planning of your particular practice and stuff. Obviously, if you are interested in getting a hold of that, let me know. More than happy to share that resource and stuff in terms of through the list and things. And obviously, if you want to add to this, if you feel there's sections missing, I'd value your feedback. I have created this with the support and guidance of some of the local clinicians, and even shown it to Dr. Nikki Kanani, who says it looks like a useful document. Clearly needs guidance, which is what the document is there for. But I hope that many of you find this document useful and effective in terms of driving forward both your practice direction, but also in supporting you to develop your networks to be more effective and hopefully functionable. If you want to find more of these resources, as usual, feel free to subscribe to our channels, particularly on YouTube, by ringing the bell to make sure you get all the future videos, or follow us on our Facebook page or on Twitter at EGP Learning or at Dr. Gandalf 52. If you do want any further information, feel free to contact me through those particular networks. More than happy to hear from you guys and see what else we can do to try and support you. And if you've got any questions, feel free to contact me. Anyway, guys, as always, make sure you keep looking after yourself and subscribe, comment, share. Let's keep tech enhancing your primary care and learning. See you later.